Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And here at Gold, we are in the middle of recording a brand new lecture pack, and that lecture pack is titled Breastfeeding and Medically Complex Infant Lecture Pack. So before we go into details about the lecture pack, what we like to do here also at Gold is meet with our speakers so you can meet them. We want to talk to them a little bit about their professional journey and what they're working on now, and then of course about the presentation they're having in this lecture pack. And with me today is a special guest who has presented with us here at Gold before. It's Lyndsey Hookway. Welcome back, Lyndsey.
Hi, thank you so much for having me.
It is so lovely to have you. And finally on video, finally our listeners get to see and meet you here on video as well. How are
That's
you
great.
doing today?
I'm very well, actually. Fortunately, given the global chaos
Yes.
that's going on, I'm good. I'm good. No comment.
Absolutely, absolutely. Yeah. So many of you, of course, know you in the lactation world. You, of course, are a big name, and we had you at Gold presenting before. But for our listeners here who are new to Gold and maybe new to lactation as well, so you're an IBCLC, a pediatric nurse as well, and a sleep expert, a holistic sleep expert, I should say. And so tell us a little bit about your background, your work, and what you're involved in right now.
Well, so I've been working with little ones. I started my nursing training back in 2001, and I worked in a variety of different major London teaching hospitals, and then I sort of wafted my way into the community, and then went into public health nursing. Before I also worked in neonatal intensive care, so I was the or one of the first family-centered care coordinators, or otherwise known as bliss nurses. So I coordinated developmentally appropriate care of families and infants in the Southwest London Perinatal Network, and that was a wonderful job. That was coming on for, I don't know, 10, 11 years ago now, and around the same time I took the IBCLC exam, so I've been board certified as a lactation consultant for 9 years. And I don't really consider myself an expert in anything. I'm really, really, really passionate about families being the experts on their children. So I tend not to call myself an expert. I'd hate to be, I'd hate to sort of imply that that parents were not in fact the experts on their kiddies. But I appreciate that some people kind of want somebody with expertise in sleep that is
Mhm.
respectful to the breastfeeding and gentle, responsive parenting relationship. So that's kind of where I situate that particular sort of area. But yeah, I suppose the reason why I'm here today is because of my pediatric nursing and IBCLC interface. And yeah, I have a deep and enduring heart for maintaining breastfeeding during infant and child hospitalization, because I've seen it. I've
Mhm.
seen breastfeeding just get canned when kiddies get hospitalized with various different illnesses. And
Mhm.
that's been over, 20 years certainly of my career. And I know a lot of my colleagues, people who work in very similar fields, see a similar kind of pattern, sadly, that, when kids
Yeah.
get admitted, when they have an acute or chronic problem,
Mhm.
breastfeeding kind of just goes by the wayside. Yeah.
Yeah. Yeah, I loved how you put yourself as like you are so right. The parents are definitely the experts there. They know their child, they have these the deep bond with their children and of course looking for guidance there, especially when children are hospitalized. And thank you for all the great work you're out doing there in hospitals and in the community there as well. And you're right. I mean, yes, breastfeeding falls by the wayside, especially with little ones in the NICU and little ones with medical issues. The focus to me, and it's gotten better. And correct me if I'm wrong. What you seeing in your community too? It was mainly the focus was on let's get this baby stable, let's get this baby healthy. We need the medical interventions and nutrition. Just we give the baby nutrition, but the rest has priority, right? And I think, do you think it has to do with that we see how important breast milk is? That we have now all this research on the wonderful benefits of breast milk. We knew for a long time breast milk is good, but now we have like all these evidence to back it up. So is it now that hospitals follow suit more? What do you see?
Maybe I think there's been a lot of work within the neonatal intensive care environment. What I'm not seeing yet, and that's what a lot of my research work is about, is a shift to see that work moved into pediatrics. So
Mm,
what I see in the literature and from experience as well is that there is a much bigger shift towards supporting breastfeeding and exclusive breast milk feeding and the use of donor milk, for example, in
right.
neonatal intensive care. But there really isn't that momentum yet within pediatrics. So that's really my focus of interest, because I think in cardiac critical care and in pediatric critical care, it doesn't happen. And if you are a 6-week-old baby admitted with gastroenteritis or bronchiolitis and you're exclusively or partially breastfed, what we know is that it's very, very likely that your hospitalization is going to get drastically impacted by that hospitalization, even if it's only for 2 or 3 days.
Yeah.
So we know that the rate of short-term admission to hospital is increasing for a variety of reasons.
Hmm.
And we know that it's not necessarily the severity of infant illness that is associated with cessation of breastfeeding or reduced exclusivity of breastfeeding. So this is really a mucky, messy
Yeah.
issue that I'm trying my best to unpick, but there's not a lot of data. So that's kind of the next thing that I'm
The
working
next
on.
thing that you will be working on, promoting research in that area as well. And I can see how detrimental that can be. Yes, you're right. In the NICU, we're doing a lot of good steps already. But then if a baby or child is brought in exclusively breastfed with issues that occur, that maybe at birth weren't immediately clear, or, and then breastfeeding is being put by the wayside, it has huge impact on not only on the baby, but the entire family. There's so much more to nursing or breastfeeding or chest feeding than just nutrition. It's the bonding, it's the brain development for that baby as well, and for the mom with regards to postpartum depression. It's like this whole big area that that
Yeah,
opens up, right?
absolutely. Absolutely. It's hugely under researched, and certainly
Mm,
what I've found from the families that I've supported is that they've, when their child's got a long-term congenital malformation, for example, they have reported that they've had really good care in the NICU,
mm-hmm.
or if their baby's been born very prematurely, they've had great care in the NICU, but when their baby becomes a NICU graduate, if they are then subsequently admitted to PICU, the pediatric intensive care unit, or they're just moved to a pediatric ward, that's when
Right.
it's going to go
Yeah.
down the
So
pan,
and that's
unfortunately.
yeah, and that's the next step in line where, I
Yeah.
think, yeah, hopefully this is the natural development. We have made great strides with baby friendly hospitals and what's happening in the NICU. Hopefully this is the next area now that will catch on, and due to people like you being out there in the community educating, and hopefully we get this going very soon. Now we want to definitely talk about the presentation here at Gold. Your presentation is titled Breastfeeding Children with Cancer. And this is for you very personal. So tell us a little bit about that.
Yes, so I mean, this has been a passion of mine for a very long time, but sometimes just like a plumber gets a burst pipe, sometimes an IBCLC and pediatric nurse, who happens to be married to a doctor as well,
Mm-hmm.
uh, gets a very sick child on their hands. So my daughter was diagnosed with sepsis when she was 3. It came out of the blue. She was well and happy and thriving and still breastfeeding. And then when she was 3.5, she became extremely unwell and was subsequently diagnosed with leukemia. So yes, it is a kind of a personal journey that was sort of brought into sharp focus by being reminded in a very visceral way that the research in this area is massively lacking.
Mhm. Yeah.
um, but we generally had a good experience. Maybe because people didn't dare cross me or give me the side eye when I was
They
nursing
knew you
my,
were a pediatric nurse. They knew you knew what they're talking about. So
like, stay away from her. Don't mention the breastfeeding to Lyndsey or she'll snap your head off. Maybe, I don't know.
yeah.
So I actually had a pretty good experience, but sadly, that's not everybody's experience. They're not all universally encouraged and supported, and I've met a lot of people who are still breastfeeding their kiddies through cancer who have not been very well supported at all. And certainly my small survey of families didn't find that it was supported as a general rule. There were, of course, isolated positive incidents, but it was they were really the exception rather than the main. So yeah, so we nursed throughout chemotherapy. So she had 26 months of chemotherapy and lots of treatment, and she's now in remission and doing very well. But and our breastfeeding journey has also ended.
Mhm.
But I can't prove what breastfeeding did for her, but I do know that she's been a lot less sick than other children with similar diseases. So who knows? Who
Right.
knows, right?
Right. And I'm so glad to hear your daughter is in remission and doing well. Thank you for sharing that. Yes. So the presentation, yeah, I can only imagine how difficult it is to have this diagnosis for a parent, of their child having cancer, and then breastfeeding. What experts are saying. I mean, there's this huge, probably confusion of what to do, what the next step is. And you're right. There's probably very little support out there. So tell us a little bit also about your presentation, what you will be focusing on.
Well, I'm going to be. I'm not an oncologist, so it's not going to be in-depth information about cancer.
Mhm.
It's more about the types of treatments and challenges and roadblocks that can crop up along the way when you're breastfeeding a child with cancer, and some of some areas to think about perhaps, and some potential things that we might need to, just learn a little bit more about, actually, perhaps accept that we don't know everything yet and we need to investigate some of these areas with a little bit more humility,
Yeah.
a little bit more open-mindedness about what might work, and what compromises might need to be made, or whatever. But also acknowledging that actually all cancers are different, all children are different, all stages of lactation and family circumstances are different, and how does all of that kind of fit together, and help us to be respectful and compassionate practitioners when we're trying to support breastfeeding, and ultimately keep families together,
Hmm.
look after their mental health, their emotional well-being. It's not just about surviving cancer, it's about
Right.
being able to thrive a little bit through it as well. And
Yeah.
I recognize within that my own privilege, and our own privilege with having a survivor of cancer versus some of the many families that I've met who have sadly lost their children along the way, and can't say that. So I definitely acknowledge that privilege, but I do think that there is a huge amount to learn here, and not just really about cancer, but we can um, we can sort of extrapolate some of this information to other serious childhood illnesses as well, although some of it is very, very cancer specific today.
Mhm. Absolutely. Well, thank you. Yes, definitely. This information is much needed, and anything we can learn as lactation professionals or professionals out there in the field to assist our clients in their journey is definitely very beneficial. So, thank you for that.
You're very welcome.
Yeah, and I'm looking forward to the presentation here. Breastfeeding children with cancer is part of our lecture pack here at Gold, Breastfeeding and Medically Complex Infants Lecture Pack. This will be brand new, available in March 30th here. That's just around the corner, and you will learn about infants with childhood cancer, as we mentioned now, breastfeeding and late preterm infants, neurological conditions, congenital heart disease, and babies with Down syndrome, and much more. So we would like to invite you to check out this lecture pack, and you'll find out more information about Lyndsey's presentation and all the other presentations in the lecture pack by visiting goldlearning.com. Thank you once again, Lyndsey Hookway, for sitting down with me here and chatting a little bit. And I wish you and your family well, especially in this time. We are in the time of the coronavirus, so all the best to you, and of
Thank
course
you.
to and all our listeners out there. Wish you the best and stay safe. Bye bye, everyone.